Welcome to Perioperative Chest X-ray Interpretation for Anesthesia Providers, Module 2. In this module, we will evaluate endotracheal tube placement. The objectives and aims of this module include identifying proper endotracheal tube placement and identifying the right mainstem bronchus intubation. As a reminder, this module is not intended to direct diagnoses based on chest X-ray interpretation. The carina is a piece of cartilage at the base of the trachea separating the right and left bronchi. It is often used as a landmark on chest X-rays to identify proper placement of tubes and invasive lines. Anatomically, the carina typically lies at the level of the fourth and fifth thoracic vertebral space. There may be slight individual variation, meaning the carina may be anatomically located at a vertebral space above or below T4, T5. As stated previously, the carina can be used as a landmark for endotracheal tube placement. The tip of the endotracheal tube resting 3 to 5 centimeters above the carina indicates optimal placement. If the carina is not visible on the chest X-ray, the examiner can approximate the location of the carina by identifying the T4, T5 vertebral interspace. In this chest X-ray, the ribs have been numbered as indicated by the yellow numbers 1 through 12. Thoracic vertebrae have been numbered as indicated by the yellow T1 through T12. To approximate the level of the carina using vertebrae as landmarks, the examiner starts by counting ribs. Begin by identifying the anterior aspect of the first rib. This is the first rib here in blue. The first rib is C-shaped and appears much shorter and more vertical compared to other ribs. The first rib connects to the first thoracic vertebrae. From the carina, the right bronchus branches off at a more vertical 25-degree angle, and the left bronchus branches off at a more horizontal 45-degree angle. The more vertical angle of the right bronchus contributes to right mainstem bronchus intubation. Unrecognized bronchial intubation may lead to atelectasis of the contralateral lung, barotrauma of the ipsilateral lung, and hypoxemia. Can you identify the abnormality on this chest X-ray? This chest X-ray image is from a study of a 45-year-old female undergoing a surgical procedure. Following induction, the patient became bradycardic and hypotensive, increased airway pressures, and progressive hypoxemia. This chest X-ray is of a right mainstem bronchus intubation. The endotracheal tube extends beyond the carina into the right mainstem bronchus. There is a pacification of the left lung, likely representing resorptive atelectasis in this clinical context. This is a follow-up chest X-ray of the same patient in the previous scenario. A chest X-ray was obtained after the endotracheal tube was retracted several centimeters and the tip lies above the carina. There is also reaeration of the left lung.